All right, Carl. Looks like we're getting ready to start out here, and I'll help out as much as I can. Um, I think we're gonna start with some ice, try to manage that pain a little bit and get those symptoms to die down a little so that we can do some work today. But before we do that, I wanted to just talk to you and clarify, check and see if you had any of these, any contraindications to using ice. So I'm gonna go through a list and you just tell me yes or no. So do you have any circulatory or compromise or peripheral vascular disease, cardiac dysfunction, impaired sensation, um, over regeneration of peripheral nerves, cold intolerance or hives? Do you get a rash when you get cold or when something cold is on your skin? Do you have cryoglobulinemia or cold hemoglobinuria? Or do you have Raynaud's? No, none of those? That's perfect. We're gonna move on to another list. So, do you have any hypersensitivity or hypertension? You do have hypertension, and you are 74 years old. It does look like you are very alert and aware. So, based on your age and your history of hypertension, I would like to be careful with this cold. I'm gonna make sure I'm checking often and make sure that you still have good blood flow and that you're doing well. So the next plan, we're gonna do ice for about 15 minutes. I'm gonna have you laying down on your back and we're gonna support your left leg and we're gonna get it a little elevated. So what I want you to do is just relax, just do what you can to really deal with the cold, however. But if you need anything, I'll give you this bell. You can ring it, or if you need me for any reason, just call out. I won't be far, and I'll be here to check frequently in with you in those 15 minutes. With that being said, is it okay if I expose your knee and look at it and feel it so that I can do an assessment to make sure that there's nothing else going on before we get the ice on it? That's okay. All right, so if you don't have any questions, is it okay if I touch your knee and get you set up with everything you need so we can ice this thing and hopefully get you feeling better?